Hi. A very good evening to all of you. I believe I'm audible and visible at your end, right? Everybody? Audible, visible, everything clear? Just give me a thumbs up. Good evening. Good evening to all of you. Yes, yes. Hello, 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 everybody. I'm getting your chat. Okay. I believe your exam preparation is going on well, right? Because your exam is just knocking at the door. So, good evening. Good evening. Very good, very good. Right. So as you know, this is a session which is LRR for FMG exam for your upcoming exam, and this is the last revision or the last resort revision, right? So in physiology, there is a last resort reflexes. You know that when your blood pressure is very very low, there is one reflex which is activated when your blood pressure is very low, below 50 millimeter of mercury, and if that reflex has failed, then the person may going to die because the blood pressure is not going to revive. So could you recall what is the name of that reflexes in CNS, I mean CVS physiology? What is the name of that reflexes which is activated when the blood pressure is below 50 millimeter of mercury, and that is known as the last ditch resort. Okay, so like last resort revision. So there is an reflexes in the CVS. You have to recall that reflexes which is known as the last ditch resort. No visual juris, no baroreceptor, no, 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 no. No, last ditch resort or last ditch response, which reflexes in the cardiovascular system, is known as, very good. Now the question's answer is coming. Yes, 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 good. So that is known as the CNS ischemic response, right? So please remember, this is another MCQ. Sometimes they may ask you directly that which of the following is known as the last ditch, okay, resort, okay, or last ditch response in the CVS or the cardiovascular system, which restore your blood pressure, and if that reflexes fail, then the death may occur. So that is known as the CNS ischemic responses. Okay, chalo. So in this session will continue maybe 1.5, maybe maximum 2 hours. So within this 2 hour session, we are going to do three things mainly. One is important one-liner. So single line I have written, and that is mainly based on your POQ. Then we are going to discuss certain important images which are important for your FMG examination. And third, we are going to discuss certain important tables and some math. Some, some mathematical problem in physiology is also given. Very simple mathematical problem. So that mathematical problem and some table format information. So these are the three main things that we are going to discuss here. So first thing that we are going to discuss, the important one liner or important single liner. So here most of the things, the last resort revision, most of the revision will be covered up in this one liner session. Then we'll be discussing few image and few tables and mathematical problem. That is our session today, right? So now look at the first one has been recently asked in your exam. Could you answer what will be the answer of this question? So a tracker at high altitude develop ataxia and confusion followed by pulmonary edema. So whenever you are getting a question like this, the tracker is developing ataxia and confusion. So this is basically a high altitude. Okay, so you all know that this is high altitude cerebral edema, ataxian component of the high altitude cerebral edema, followed by pulmonary edema. So this is HAP. So whether it is high altitude cerebral edema or high altitude pulmonary edema, yes. So the most important management is oxygenation improvement. So oxygen supplement. If that is not, then rapid descent. Okay, rapid descent. Please don't say steroid, don't say your calcium channel blocker. Those are the drug, that is the second thing. But whenever the question is that what is the most definitive, most appropriate treatment in these cases, first of all you have to improve the oxygenation. So if you have oxygen, so give it with the help of the face mask or anything. Okay, Even if you give oxygen also, then also you have to do a rapid descent, because in high altitude the main problem is because of the hypoxia. So you have to treat the hypoxia first. So इसलिए if you have to choose that which of the following is the most definite treatment, oxygen and rapid descent will be the answer, not the corticosteroid, not the nifedipine. Corticosteroid is given for high altitude cerebral edema, yes, and the nifedipine or the calcium channel blocker is given for the high altitude pulmonary edema, but they're the second line of drug. First is the medicine. Okay, first medicine is basically oxygen and rapid descent. Okay, this was question, and rapid descent was given in the choices, so that was the answer in the question. Next question answer. Receptor mediate stretch reflex is. So we have discussed this multiple times. So receptor for stretch reflex is which one? The muscle spindle. And the receptor for inverse stretch reflex is Golgi tendon organ. Okay, so please don't forget that these two receptors are known as the proprioceptor. The muscle spindle is dedicated for detecting the length of the muscle. So these are the short small information, but this information will be helpful for MCQ. So muscle spindle for detection of the length and velocity of the muscle. Okay, length and velocity both can be detected by muscle spindle, and Golgi tendon organ is for detection of the tension at the level of muscle tendon. Golgi tendon organ is for tension detection at the level of muscle tendon. When muscle tendon is tense, then the Golgi tendon will be activated. Two famous question, please remember. Okay, T for T for tendon, T for tension. Okay, now next question is again a very famous. The nerve, the resting membrane potential of the nerve fiber is close to. In my every classes, I keep this question because there is a little confusion whenever the question is close to and whenever the question is equal to. I told you there will be two different answers. So whenever the question is close to any nerve fiber, any muscle fiber, any cells in the body, answer is equilibrium potential of potassium. But whenever the question is equal to, then look at which tissue they are asking about. If it is nerve fiber, we know the nerve fiber has an RMP of minus 70 millivolt. Now we have to think of an ion which also has an equilibrium potential of minus 70, and that is my chloride. So in this cases, answer will be the chloride. But if I ask you the last line of this table, last line of this slide, so resting membrane potential of myocardium. So I told you, look at the tissue. So myocardium has an RMP of minus 90 millivolts. So this is the RMP. So you have to think of an ion which has a resting membrane potential of minus 90, and that is nothing but the potassium ion. One second, getting my point? So this way you have to remember that. Please you have to remember like this, that if it is answer is close to, then always the answer is potassium. But if it is equal to, look at the tissue which they are asking about. If they are asking about myocardium, so search an ion which has an equilibrium potential of myocardium RMP, right? So this way answer this. Next, a patient with a history of head trauma present with signs of, again a very famous MCQ, okay, and a very famous topic in your FMG exam. Bolo answer batao, what will be the answer? A patient with a history of head trauma presented with signs of increased intracranial tension. So just before the starting of the class, we were discussing that there was one reflexes which is known as the CNS ischemic response. So you were discussing that there is a response which is known as CNS ischemic response. So one sort of, so the CNS ischemic response will be started in one of the condition when the person is suffering from this kind of increased intracranial tension, and whenever the CNS ischemic response is activated, there will be increase in blood pressure of this person. That increased blood pressure will decrease the heart rate by reflex activation, baroreceptor reflex. So increase blood pressure, decrease heart rate, along with there may be irregularity of respiratory rate and rhythm, irregular respiration. So combination of these three features, which is also seen in this patient, this is known as the Cushing reflex. So I believe you don't forget this important reflex. So this is known as the Cushing reflex. So if I ask you what happens in Cushing reflex, so Cushing reflex is basically a kind of CNS ischemic response. Whenever the increased intracranial tension is there, that increased intracranial tension will causes compromisation of the vasculature of the blood brain. So because brain. So because of the compromisation of the vasculature, what will happen? The hypoxia will be happening. That hypoxia will increase the blood pressure. That increase in blood pressure will decrease the heart rate reflexly. Along with that, increase intracranial tension will causes irregular respiration. Combination of these three is causing reflexes. Okay. Next question ka answer. So hormone that regulate blood level of 125 dihydroxycholecalciferol. So 125 dihydroxycholecalciferol, which is also known as calcitriol. This is another MCQ in your exam only. Calcitriol. So this calcitriol activation occurs at the level of kidney, and at the level of kidney, you know, there is one enzyme, that is 1-alpha hydroxylase. So this 1-alpha hydroxylase enzyme is positively stimulated by which hormone? Your answer is parathyroid hormone, right? Very good. So all of you are giving very good answer. So I am understanding that your preparation is going in the right direction. Best of luck for your upcoming exam. Very good. Okay, so parathyroid hormone stimulate this 1-alpha hydroxylase enzyme, right? Okay. Now next one, the best stimulus for vasopressin. Okay, so here you have to look at which options they have given, but you have to remember the best stimulus for vasopressin is increase in osmolality of blood. Increase osmolality, if it is not given, increase sodium concentration in the blood. Okay, even if that is also not given, then you have to look at hypotension, decrease blood pressure or blood volume. If there is severe hypotension or decreased blood volume, then what will happen? Okay, the angiotensin 2 is also a stimulus for this vasopressin secretion. So at least remember this. So osmolality have answer, osmolality have given the answer. That is best one, that is the best one. Increase osmolality of the blood. So how the increased osmolality is related to the vasopressin secretion? Could anybody told me? So if I ask you osmolality, suppose your blood osmolality is high, which receptor will detect this osmolality of the blood? Yes, pain, nausea, vomiting, they are also the stimulus for the vasopressin secretion. Very good. But could you recall osmolality, where the osmoreceptor present in our body? So please remember, this is an additional MCQ. Osmoreceptors are present at the level of anterior nucleus of hypothalamus. Anterior nucleus of hypothalamus. So this osmoreceptor will be activated first, then it is going to stimulate the ADH secretory neuron, that is the hypothalamic neuron, you know, supraoptic and paraventricular neuron. Those neuron is going to secrete the vasopressin or ADH. ADH is going to act at the level of kidney on which receptor? V2 receptor. Okay, that question I was not asking. I was not asking ADH act on which receptor. I was asking that this osmolality is high. That means how the blood osmolality is sensed by the body. That is the anterior hypothalamic nucleus, anterior nucleus of the hypothalamus. Okay, this is one of the important question. Okay, so preoptic nucleus का आसपास ही होता है, so that is the anterior nucleus of the hypothalamus. Very good. Okay, now inhibin is secreted by, answer बताओ, if it is a male and if it is a female. So please remember the inhibin is very very important, because inhibin is the negative feedback hormone for FSH control. FSH secretion ka inhibin is the negative feedback control. So in case of male, yes, sertolizumab. Very good. In case of male, sertolizumab. So this is the answer in case of male. But in case of female, what will be the answer? Inhibin is secreted by, in case of female. So क्या आंसर होगा? I am waiting for male, sertolizumab. Yes, for male. Very good, beta, very good. Impressed. Granulosa cell. So granulosa cell in the proliferative phase of the menstrual cycle, and corpus luteum can also form. Corpus luteum can also form inhibin A basically. So inhibin B is basically granulosa cell, and inhibin A basically corpus luteum. So you remember, not the detailed one, but at least you remember that granulosa cell also have to remember. That is the main answer. Corpus luteum can also produces inhibin, that is inhibin A particularly, and in male it is exclusively produced by sertolizumab. Very good. Impressed. Okay, chalo. Center controlling vomiting, all of you know the center is known as the chemoreceptor trigger zone, which is also known as the area prostrema. Okay, area prostrema, right? So I'm not going to write much. Now event at the end of the isovolumic relaxation. So whenever you are getting this isovolumic relaxation phase or isovolumic contraction phase, remember 2-3 important points regarding this. Okay, 2-3 important points. Yes, CTZ is done. CTZ or area prostema, that I told you, area postrema. Okay, so that you know. Okay, now isovolumic relaxation or isovolumic contraction. If I ask you what happens during this phase, if I ask you what happens during this phase, you will answer that all valves are closed. All valves are closed during this isovolumic relaxation phase. But whenever the question is what happens at the beginning or the start of the isovolumic relaxation phase and at the end of the isovolumic relaxation phase. So please remember, isovolumic relaxation phase means beginning will start with the closure of semilunar valves and ending will happen. So after the isovolumic relaxation, now what is going to happen? The ventricle is going to get the blood from the atrium. So how it is going to get? There should be opening of AV valves. Getting my point? So please remember that whenever the question is at the end of the isovolumic relaxation, so obviously the answer is going to be the opening of the AV valve, atrioventricular valves, tricuspid and mitral valve. But if the question is what happens at the start or beginning of the isovolumic relaxation phase, your answer will be closure of the semilunar valve. Same way, whenever the question is about the isovolumic contraction phase, इसका भी दो answer you have to remember. So at the start of this isovolumic contraction phase, who will tell me the answer? At the start of the isovolumic contraction phase, what happens? Starting of isovolumic contraction. So whenever the ventricle starts systole, okay, opening of the semilunar valves, okay, start of the isovolumic, that is at the end of the isovolumic contraction phase, okay. So at the onset of the isovolumic contraction, at the onset of the ventricular systole, whenever the ventricular systole begins, it begins with the closure of the valve. So दोनों को ही एक बार एकदम बहुत अच्छे से देख लो. Isovolumic contraction हो जाए, isovolumic relaxation हो जाए. In both the phases, the phase start with the closure of one valve. The phase start with the closure of one valve. So this is the closure of AV valve. So AV valve was open. Now this valve is getting closed. And at the end of this isovolumic contraction phase, there will be opening of semilunar valves. समझ में आ रहा है? So very important that isovolumic phase means beginning will start with the closure of the valves. That's why another MCQ can be asked from here, that first heart sound occurs in which phase of the cardiac cycle? Beginning of the isovolumic contraction or ending of the isovolumic contraction? So whenever I'm asking this question, you already got the answer. So first heart sound occurs at the beginning or at the end of the isovolumic contraction. Your answer will be at the start of the isovolumic contraction, because that is the closure of the AV valves. If I ask you second heart sound occurs in which phase of the cardiac cycle? At the start of the isovolumic relaxation or at the end of the isovolumic relaxation? Easily you can answer at the start of the isovolumic relaxation. So this way, please remember these four important MCQ regarding the isovolumic contraction. But I told you that if the question is what happens during the isovolumic phase, then always your answer is that all valves are closed during the isovolumic phase. Okay. Now next question. Renin is secreted by. So renin is secreted by which cell? Okay. So all of you know the renin is secreted by JG cell of the kidney. JG cell of the kidney. Okay. Renin is secreted by JG cell. There is no confusion. And erythropoietin is secreted by. So erythropoietin is secreted by peritubular capillary epithelium cell. Peritubular capillary epithelium cells. Peritubular capillary epithelium cells. And in last classes I told you, in YouTube session only, I told you there is another cell which has recently been discovered, NORN, Norn cell. Okay, NORN, Nord cell, which also you have to remember that erythropoietin is secreted by from this peritubular capillary epithelium cell also. That is the main thing. Okay, so that is what liver you are talking about. So in kidney we are discussing the which cell is going to produce. Okay. Okay. ठीक है, stromal cell. Yes, it's a kind of stromal cell, peritubular capillary epithelium cell. Okay. So spleen can also secrete a little bit, brain can also secrete a little bit, but those are the very unimportant things. So you must have to remember that the main secretion of erythropoietin is from kidney. That is the around 80 to 90% of the erythropoietin secretion. 10% secretion is from liver, and in kidney, which cells it is going to be produced? That answer I told you already. Just yes. Okay. So you remember peritubular capillary epithelium cells of the kidney along with the node cell, NORN cell. Yes. 80 to 90% kidney, 10% liver, that is a perivenous hepatocyte in the liver. Okay. And spleen, even the brain cell, the little amount of mRNA of the erythropoietin has been discovered. That's why they are saying that may be the source of erythropoietin, but that is not in the book yet. So you may, yes, node cell. Okay. NOR, NORN, right. Chalo. Now, which structure connect the Broca area with the Wernicke area? So all of you know that this is known as, what it is known as? Broca to Wernicke area. What is the name of that? Yes. So answer is arcuate fasciculus. I know you know the answer. Arcuate fasciculus. Chalo. Next is the which part of the thalamus is related to motor control. Okay, so motor control. So here you remember at least two nucleus of the important nucleus of the thalamus. So whenever I say that which thalamic nucleus is responsible for sensory integration. So please remember here one important concept, all the ascending tracts. So all the ascending tracts, right? All the ascending tracts, they goes through which nucleus of the thalamus? They goes through the ventroposterolateral and ventroposteromedial nucleus of the thalamus. But whenever it is the control of the motor control by thalamus, then you have to remember ventroanterior and ventrolateral. These two nucleus are responsible for motor control at the level of thalamus. So they are basically connected with the basal ganglia, and cerebellum, and because of the basal ganglia and cerebellum connection, so this ventro-anterior and ventrolateral nucleus of the thalamus is responsible for motor control. Okay. Now the next one, resistance against passive stretch or the resting tension of the muscle. This question has already been asked from in your FMG exam only. VPL and VPM both. No, not at particularly phase. This is VPL and VPM both are there for the ascending tracts. Okay, VPL, obviously VPL is main, but also VPM component is also there. So this is known as the muscle tone of the muscle. Okay, an active force generated by a muscle against resistance. So whenever you are giving certain resistance, I am trying to actively contracting these muscles. This is known as the, okay, what is this? So active force generated by a muscle against resistance. So this is known as the power of the muscle. Very good. So active contraction is basically power, and passive, when the muscle is passive, when the muscle is in resting condition, you know there are certain resistance inside the muscle. So that resistance, if you feel, that is known as the palpation of the tone of the muscle. But whenever the muscle is actively contracting, the force generated by the muscle is known as the power of the muscle. So tone and power, you have to remember. Now, this is one of the question which I believe is a little difficult in your exam. Reward center of the brain. So this question was used to be asked in INI-CET type of question, but nowadays they're asking in your question, your exam also. So please remember, reward center which was given in choices in your exam was the ventral tegmental area and nucleus accumbens area. But apart from that, medial forebrain bundle you also try to remember. So the medial forebrain bundle, okay, as well as the ventral tegmental area, as well as the nucleus accumbens, they are known as the reward center of the brain. And punishment center of the brain, what are they? So the periaqueductal gray matter region, central gray area, that is the surrounding the aqueduct of Sylvia, that is the periaqueductal gray matter of the brain, they are known as the punishment center of the brain. Okay, so please remember, so periventricular zone of hypothalamus also has certain punishment center role, but the main punishment center is periaqueductal gray matter central area, that is a PAG, periaqueductal gray matter region, and periventricular zone. Important, try to remember. Now already we have answered this question, that active form of vitamin D3. I told you that this is 125 dihydroxy cholecalciferol, which is also known as 125 dihydroxy cholecalciferol, which is also known as calcitriol. Okay, so Hindi English बोलेंगे तो it can be problem for many, so that's why I'm not trying to speak. But Hindi English अच्छा लगता है उसको obviously, but it can be problem for many, right? चलो, क्या फर्क पड़ता है, हिंदी इंग्लिश बोले हिंदी बोले, क्या फर्क पड़ता है, अंडरस्टैंडिंग हो रहा है तो दैट्स ऑल ना। ओके, चलो, सो एक्टिव फॉर्म ऑफ विटामिन D3 इज कैल्सिट्रायल, ठीक है। चलो, now next question is again one of the important MCQ which has been asked by giving some clinical type of scenario or direct question. So you have to understand the difference between two terms. One is hyperalgesia and one is allodynia. Hyperalgesia and allodynia. So in my lecture class, in my lecture video, maybe some YouTube session, I have explained that if I give a stimulus like this, so this is a mechanical stimulus which is producing pain, right? But if I am feeling exaggerated response, if I am getting huge pain, okay, so I am giving this stimulus but I am getting huge pain. So what is that? That is known as the hyperalgesia. So here the stimulus is a noxious stimulus, mean the stimulus is supposed to produce pain, but in that little amount of pain you are getting an exaggerated response. So ये हो गया हमारा hyperalgesia. Now whenever I am giving a touch sensation on your body, or suppose warm water, little warm water, lukewarm water you are giving on the surface and the person is having pain sensation. So touch is not supposed to give you the pain sensation. The lukewarm water is not supposed to give you the pain sensation. But whenever the person is getting the pain sensation in response to innocuous stimulus means this is a non-harmful stimulus. The stimulus is not supposed to give you pain sensation, non-painful stimulus, but in that non-painful stimulus you are getting pain. So that is known as the allodynia. Right? Okay, chalo. Now adequate oxygen delivery at the cellular level occurs in which type of hypoxia? So all of you know that there are 4 types of hypoxia: hypoxic hypoxia, anemic hypoxia, okay, histotoxic hypoxia, and your stagnant hypoxia. So anemic hypoxia, right? So hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. Adequate oxygen delivery at tissue level occurs in which type of hypoxia? बोलो आंसर क्या होगा, एक आंसर नहीं बहुत आंसर होगा। ओके, एडिक्वेट ऑक्सीजन डिलीवरी बोलो। सो हाइपोक्सिक हाइपोक्सिया में हो सकता है क्या, हाइपोक्सिक हाइपोक्सिया। So in hypoxic hypoxia, what is the basic problem? The basic problem is partial pressure of oxygen is low. Because of the decrease in partial pressure, the oxygen delivery at the level of tissue is low, so it is not the answer. Then second is anemic type of hypoxia. Problem is decrease in hemoglobin. That's why this is anemic hypoxia, or maybe carbon monoxide poisoning. So again, if the hemoglobin is not adequate, so adequate oxygen is not going to be delivered at the level of tissue. This is not going to be the answer. Third type of hypoxia is the stagnant hypoxia. So in case of stagnant hypoxia or ischemic hypoxia, the blood flow to the level of tissue is decreased flow of the blood at the level of tissue. So if the blood flow is decreased, obviously tissue is also not going to get the adequate oxygen. But whenever you are thinking of the last type of hypoxia, that is the histotoxic hypoxia. So here the problem is tissue is damaged due to the cyanide poisoning or the beriberi. So when the tissue is damaged, tissue is not able to take the oxygen, that's why the hypoxia is happening, but there is no problem in the supply of the oxygen at the level of tissue. So this will be the answer. Why carbon monoxide poisoning has anemic hypoxia? Because all of you know the carbon monoxide has 250 times more affinity for hemoglobin, so it will occupy the hemoglobin and it will not allow the oxygen to released at the level of tissue. Oxygen released will be hampered, so that's why carbon monoxide will also causes the functional deficit of hemoglobin like situation. Okay, so either the anemia is what? Anemia is a quantitative deficiency or qualitative deficiency. In carbon monoxide, the quality of the hemoglobin is decreased. So that's why that is also under the anemic type of hypoxia. Okay, but cyanide poisoning, histotoxic hypoxia, beriberi or vitamin B1 deficiency, if it is severe, then that can also produce histotoxic hypoxia. In case of histotoxic hypoxia, there is problem at the level of tissue. Tissue is not utilizing oxygen, but there is no problem at the level of supply chain. So oxygen. Hypoxia question, please repeat. Okay, so hypoxia, one is known as the hypoxic hypoxia. If a person is ascending to high altitude, that is an example of hypoxic hypoxia. The problem is decrease in the partial pressure of the oxygen in the blood. So high altitude hypoxia, or if there is decreased ventilation at the level of lung, or if there is problem in the diffusion at the level of lung. So at the problem of lung, or maybe at the problem of heart, or maybe at the problem of atmosphere, if the problem is originating in this area, atmospheric problem, high altitude, lung problem, आपका lung का problem, आपका heart का problem, heart there is an ventricular septal defect, or there may be an other defect in the heart. So what will happen in this cases? There will be decreased partial pressure of oxygen, hypoxic hypoxia बोलेंगे उसको. Okay, anemic hypoxia means if the anemia, that is the hemoglobin is less, or if the carbon monoxide poisoning is there, or if there is methemoglobinemia. तीनों condition में anemic hypoxia happens. One is simple anemia, second one is carbon monoxide poisoning, third one is methemoglobinemia. In all these three conditions, in anemia, the hemoglobin quantity is less, but in carbon monoxide and methemoglobinemia, the quality of the hemoglobin is less. You know, methemoglobinemia means iron is converted into ferric. So again, the tissue release of oxygen will be hampered. Carbon monoxide poisoning, carbon monoxide will occupy the hemoglobin. The tissue release of oxygen will be hampered. Again, anemia. Okay, so that is anemic hypoxia. Stagnant hypoxia, which is also known as the ischemic hypoxia. So if there is any problem in the blood flow to the level of tissue, suppose heart failure, suppose there is a local obstruction to the blood vessels, all these comes under the stagnant hypoxia because blood is flowing less in amount to the tissue, that is stagnation of the blood, right? And histotoxic hypoxia means when the tissue is damaged, there is no problem at the level of blood supply to the tissue, but tissue is damaged, tissue is not able to take the oxygen from the blood, that is your histotoxic hypoxia. ठीक है, चलो आगे बढ़े. अब देखो, next question is normal anion gap. So normal anion gap, you have to remember this value. You know from your medicine knowledge also, I believe, because normal anion gap in a person is 8 to 12 milliequivalent per liter. So this number you have to remember. Okay. Now next two question. The first question has been asked repeatedly in your exam, that first vibration is sensed by. What is the answer? Yes. So Pacinian corpuscles. Pacinian is also the best receptor for detecting the deep pressure. So please remember, if the question is vibration sense and the deep pressure sense, vibration senses and deep pressure senses are detected by which receptor? Without thinking, you answer Pacinian corpuscles. But please be a little careful. If the question is given that slow frequency vibration is detected by which receptor? Slow frequency vibration means, yes, the frequency is in and around 50 Hz. Fast frequency means 200 or more, that is for Pacinian. But in this cases, the answer is Meissner's corpuscles. Very good. Meissner corpuscles is the answer, right? ठीक है बेटा, good. Okay. Now next question देखो, major thyroxine binding protein. So you all know this is the TBG, thyroid binding globulin. TBG is the answer. Okay. उसके बाद next question देखो, corticospinal tract crosses at. So all of you know the corticospinal tract originates from the layer number 5 of the cerebral cortex. Layer number 5 of the cerebral cortex is the origin point of the corticospinal tract. After origin, okay, it crosses, you know कि 80% fiber crosses, 80% fiber crosses to the opposite side at the, okay, what was the answer of this question? Could you recall, because this is a previous question? Yes, it was the lower medulla answer. Very good. So PYQ अच्छे से कर लिया आप लोग. Very good. I'm impressed. Okay, so basically corticospinal tract crosses at the spinomedullary junction, means lower part of the medulla and spinal cord origin. That is the portion where 80% fiber is crossing to the opposite side. Some of the books are saying more fiber, but this 80% fiber which are crossing to the opposite side, it will form which tracts? It will form which tract? If I ask you, exactly, answer has been given already. So answer has been given in the chat boxes. So this will form the lateral cortico, okay, spinal tract. Excellent. This will form the lateral corticospinal tract, and the remaining 20% fiber will also cross to the opposite side, but it will mainly cross at the ending point, means the where the fiber is ending basically. Okay, it will remain uncrossed up to the level of the mid thoracic level, and at the level of mid thoracic level it will again cross to the opposite side with the help of an interneuron. The fiber is not going to cross basically, the interneuron will cross to the opposite side, and it will form which tract? It will form, yes, so this will form the anterior corticospinal tract, corticospinal tract. And I believe all of you know that anterior corticospinal tract is basically responsible for maintenance of your posture control, and lateral corticospinal tract is responsible for fine motor movement, fine motor control. Fine motor movement is for lateral corticospinal tract. Excellent beta, excellent, very good. तो अच्छा तो पढ़ाई कर रहे हो, क्या जरूरी था ये सब रिविजन देने का? यू नो एवरीथिंग, वेरी गुड, इम्प्रेस्ड. Truncal muscles, yes, that's why they're responsible for posture control. Okay, chalo. Now, hormone responsible for breast cramp during breastfeeding. So, answer is oxytocin. Oxytocin, right? Reflex responsible for tachycardia during right atrial distension. Important MCQ. Answer batao. Okay, reflex responsible for tachycardia. Oxytocin हो गया. Next आ जाओ. Next का आंसर बताओ. Yes, great. So, due to any condition, if there is engorgement of the right atrium, if there is stretch on the right atrium, so please remember, due to any condition which is causing stretch on right atrium, like for example, one important increase in venous return due to any causes. So in these cases, one reflexes will be activated, that is Bain bridge reflex. Okay, Bain bridge reflex. Okay, and whenever the Bain bridge reflex is activated, what is going to happen? There will be tachycardia. So there will be tachycardia when the Bain bridge reflex is activated. Okay, BBR, Bain bridge reflex. Okay, now next one. As the filtrate flow through the proximal convoluted tubule, the concentration of the all the following decreases except. So this is one MCQ which has been asked, where the question was asked like this, that during when the solute is passing through the proximal convoluted tubule, okay, where water reabsorption also occur plus solute reabsorption also occur. Now if you look at the absorption of the solute and what are their proportionate, that's why it is isotonic in nature. We know this thing. This is an MCQ, that during the journey in the proximal convoluted tubules, the urine or the filtrate at the level of the Bowman's capsule that remain isotonic throughout the proximal convoluted tubule. But if you look at the absorption of the solute, then you will be able to understand that at the proximal part, sodium reabsorption occurs. But most of the sodium reabsorption occurs along with the other molecule, like sodium is reabsorbed along with the glucose. Sodium is reabsorbed along with the amino acid, along with the glucose, amino with the citrate, phosphate, everything. But sodium is not basically taking the chloride. So sodium and chloride basically proportionately hota hai blood mein. Now in the proximal part, sodium is reabsorbed along with the other type of molecule like sodium amino acid, sodium glucose, sodium okay citrate, sodium phosphate, सबको लेके घुस गया, absorb हो गया. कौन बच गया भैया? क्लोराइड को छोड़ दिया. So whenever it is leaving chloride, so what will happen? The chloride concentration will be a little higher in the distal part of the distal part of the proximal tubule or the later part of the proximal tubule. Then the chloride will be reabsorbed automatically. Okay, so this way the answer of this question will be chloride. Chloride is the answer. Chalo, very good. Now the very basic and very simple question: insulin act on glucose metabolism by acting on which GLUT? GLUT consa. So insulin stimulated GLUT, all of you know, I should not take much time here, GLUT4. And I told repeatedly that whenever you are encountering any GLUT in your exam, GLUT is a kind of, which kind of transporter? Facilitated diffusion. It is nothing but facilitated diffusion. So please remember, GLUT is a facilitated diffusion molecule. Okay, now skeletal muscle, adipose tissue, which GLUT? Again your answer is GLUT4. So as you can understand from this discussion that GLUT4 is very important. But hold on, if I ask you Glucose sensor glut in pancreatic beta cell. What will be your answer? Glucose. मेरा बात सुनो ना, आप छोड़ दो ना, 4 लिखना छोड़ दो, हो गया। अब मैं क्या बोल रहा हूँ? मैं बोल रहा हूँ कि ग्लूकोज सेंसर ग्लूट इन बीटा सेल ऑफ पैनक्रियास। आंसर क्या होगा बेटा? ग्लूकोज सेंसर glut in beta cell of the pancreas. Yes, yes, yes. So whenever the question is insulin act on which glut, then your answer is GLUT4. But glucose is sensed by beta cell of the pancreas by which glut, that is GLUT2. So please remember GLUT2 is the glucose sensor on the beta cell of the pancreas. Okay. Now next one, affinity of carbon monoxide. Someone was asking that why there is anemic type of hypoxia in case of carbon monoxide poisoning, because carbon monoxide has 200 to 250 times more affinity for hemoglobin in comparison to oxygen. So if you allow carbon monoxide and oxygen to bind with hemoglobin, carbon monoxide will occupy the hemoglobin molecule easily because it has 250 times more affinity for hemoglobin binding. Okay, some of the books are saying 200, so that's why I've kept 200 to 250, but better answer is 250. Okay, 250, 200, 200, 250 भी हो सकता है. Okay, now mechanism of action of the ANP. So atrial natriuretic peptide, they act on a they act on membrane receptor, and by acting on membrane receptor they increases the CGMP, cyclic guanosine monophosphate. So apart from ANP, you know that is another hormone, that is nitric oxide. So atrial natriuretic peptide and nitric oxide, both of them act through increasing the CGMP, cyclic guanosine monophosphate. Okay, so ये दोनों नहीं भूलना है, GAN, guanosine monophosphate, cyclic guanosine monophosphate is increased by A and N, GAN, GAN. Okay, GAN, A for atrial natriuretic peptide, N for nitric oxide, they increases the CGMP. Now center for body temperature regulation. This is a very simple question. Already they have asked this question in your exam. Hypothalamus is the answer, but now they are asking a little more detail, that which nucleus of hypothalamus is responsible for thermoregulation. I believe you remember thermoregulation is a process where feed forward, okay, feed forward control system is also there, feed forward control system is also there, and feedback control system is also there. So thermoregulation, regulation of body temperature, that thermoregulation is a feed forward control system also, as well as feedback control system also. And this feed forward and feedback control system is executed at two nucleus of the hypothalamus. Remember P for C. So the posterior nucleus, P for C, PC, P for C, PC. Okay, I should not say PC in West Bengal. So P for C. Okay. Posterior nucleus is for cold sense, cold response. Cold response means if a person is exposed to cold environment, what will happen? There will be shivering. Okay, horripilation, curling of the body. So all this PC means posterior nucleus of hypothalamus. Posterior nucleus of hypothalamus is responsible for cold response. Cold response means response in cold environment, right? So cold environment में response क्या होता है? There will be a separate MCQ, that shivering center of the brain is located in which nucleus of hypothalamus? Shivering center. So shivering will happen in cold response. So whenever you exposed in cold environment, there will be shivering, and that shivering is executed by which nucleus? The posterior nucleus of hypothalamus. So cold response. And anterior nucleus of hypothalamus, is for hot response. Hot response means response is not hot, but response in hot environment response basically. So hot environment response लिख देते, otherwise it may be a confusing for you. Hot environmental response, okay, otherwise you may be thinking hot response का meaning क्या है sir? Okay, so in response in hot environment like vasodilation, like sweating, all of this thing will happen by anterior nucleus of hypothalamus activation. ठीक है, PC and anterior. So posterior and anterior both are there, but PC याद करोगे तो बाकी तो हो ही जाएगा. P for C, P for cold. Okay, चलो. Now site of action of the L-type calcium channel either in skeletal muscle or cardiac muscle. आपका क्वेश्चन आया था site of location of the L-type calcium channel in skeletal muscle, but I can give the same question for cardiac muscle also. Your answer will be T tubules, T tubules, and the L tubules, I believe you remember, L tubule is nothing but sarcoplasmic reticulum. Okay. Now here one important famous topic is there, that the calcium channel which is present at the level of this T tubule. What is the name of that calcium channel? That is basically DHPR channel. That is basically DHPR channel. And the calcium channel which is present at the level of sarcoplasmic reticulum, that is RYR channel. RYR channel. Now I'll write down one important topic here. DHPR and RYR coupling. DHPR and RYR coupling. In case of okay, cardiac muscle. In case of cardiac muscle, this is known as the electrochemical coupling. Electrochemical coupling. But in case of skeletal muscle, this is electromechanical coupling. You know, electromechanical coupling. I believe you know this thing. This is very, very important, which is coming nowadays as an exam question in NEET PG. So please remember that if I ask you how the DHPR and RYR, they are interacting with one another. So this is basically a calcium release mechanism in cardiac muscle and skeletal muscle. So calcium is stored inside which organelle? The calcium is mainly stored inside this sarcoplasmic reticulum. So this sarcoplasmic reticulum contains channel which is ryanodine receptor channel, RYR1 receptor channel. If it is mutated, then that is the your basically your malignant hyperthermia that you already given here. Malignant hyperthermia is because of the mutation of this RYR subtype 1. But that is, I'm not asking here, I'm asking that how this DHPR and RYR channel, basically T tubules and L tubule, how they are connecting with one another for the release of calcium. Your answer will be that in case of cardiac muscle, DHPR and RYR, they are connected by in case of skeletal muscle, they are connected by mechanical interaction, and in case of cardiac muscle, they are connected by chemical interaction. Electrochemical, electromechanical, ये दोनों ध्यान रखो. Okay. Okay. Next question का आंसर आपने बता दिया. Very good. I believe all of you know this thing. Thyroid hormone act through which receptor? So the receptor is located at the level of nucleus. So receptor is located at the level of nucleus. And in the jugular vein, A wave is correspond to. So we generally remember that there are three positive wave in the JVP. The positive wave in the JVP are A, C, and V. A for atrium, C for cusp. Our medicine teacher taught us like this, and V for venous return, right? So cusp means that is the tricuspid valve bulging. So bulging of the tricuspid valves is for this. Atrium contraction is responsible for the A wave, and V wave is generated for the venous return. And I believe also that X and Y descent also remember. X descent is for atrium relaxation as well as tricuspid valve pulling, and V wave Y descent is for opening of the tricuspid valve, opening of the no. Okay. Marwa sir obviously was seen him, but he was not our teacher. Dr. Arup Kundu, you must have heard his name. He has a very important medicine book. Okay. Yes. Chalo. Next question. During spermatogenesis, hormone inhibiting FSH secretion. ये क्वेश्चन का आंसर हो गया ना? ऑलरेडी बोलो तो आंसर क्या था? सो मैंने बोला था इनिबिन हार्मोन इज रिस्पॉन्सिबल फॉर इनिबिटिंग द FSH. सो प्लीज ऑलवेज रिमेंबर दैट LH hormone is under the negative control by estrogen and progesterone, but FSH hormone is under the negative control from inhibin. Okay, inhibin. Okay, so answer of this question obviously will be inhibin, right? Inhibin. चलो नेक्स्ट क्वेश्चन आंसर बताओ. Changes is seen in JVP on atrial fibrillation. So I already have answered the A, C, B wave. So obviously you are going to answer. So this is absent A wave in JVP. Absent A wave in JVP. Okay. Now, which of the following component is absent in smooth muscle? Okay, absent in smooth muscle. So, smooth muscle has many components which are absent, but you have to remember that there is no T tubules. Okay, there is no Z line. Okay, in smooth muscle, there is no troponin molecule in smooth muscle, and no titin molecule or nebulin molecule in smooth muscle. That means all these proteins which I have written here, okay, or all these tubules. So T tubules is present in skeletal and cardiac muscle. Z line is also present in skeletal and cardiac muscle. Troponin is also present in skeletal and cardiac muscle. Titin and nebulin, they are also present in skeletal and cardiac muscle. Okay, but these are absent in smooth muscle. So I also have to remember that if it is absent, is there any corresponding molecule which is similar to the T tubule? Answer is yes. In smooth muscle, there is a depressed area on the smooth muscle membrane that is corresponding, that is of the T tubule, is known as caveoli, C-A-V-E-O-L-I, caveoli. Okay, so caveoli is a little membrane depression of the smooth muscle, but that is not like that of the well-formed T tubule. It is simple a depression on the smooth muscle membrane. Z line is absent. In place of Z line, there is a dense body located on the smooth muscle where the actins remain attached. So if I ask you, actins remain attached on which of the following protein in case of smooth muscle? So पूरा question बदल गया. Don't think actin remain attached on Z line because Z line is not there in smooth muscle. Getting my point? Simple a term smooth muscle जब भी हम add कर देंगे तो your brain should be more cautious. Okay, so whenever I'm asking a question, actin remain anchored to, actin remain attached to which of the following component in smooth muscle? Z line, okay, D line, M line, and dense body. Your answer will be dense body. Please remember. Okay, so because Z line smooth muscle में होती नहीं है, ठीक है. Troponin is not there, and I believe all of you remember what is the function of troponin. Troponin is basically a calcium binding protein in skeletal and cardiac muscle. If it is not present in the smooth muscle, so obviously MCQ में they are going to ask you that what is the name of the calcium binding protein in smooth muscle. Answer is calmodulin. Very good. Okay, calmodulin तो बहुत बार क्वेश्चन आया आपका, calmodulin आया है क्वेश्चन ऑलरेडी. So बाकी का भी क्वेश्चन दे सकता है. So please remember calmodulin. And titin and nebulin is not present, and corresponding molecule is also not present in smooth muscle. Okay, calmodulin. Very good. Okay, so now oxygen sensitive channel in peripheral chemoreceptor. So whenever I say peripheral chemoreceptor, I believe all of you remember peripheral chemoreceptor means we are talking about carotid body and aortic body. Carotid and aortic body. Inside the carotid and aortic body, this is an MCQ, there is presence of a cell which is known as the glomus cell subtype 1. Glomus cell subtype 1, and this glomus cell subtype 1 is basically your chemoreceptor. So chemoreceptor is located inside the carotid body and aortic body. Inside this carotid bodies and aortic body, which cells actual is the chemoreceptor? That is the glomus cell type 1. Inside this glomus cell type 1, there is a channel which is known as the oxygen sensitive potassium channel. So inside the glomus cell, there is a channel which is known as the oxygen sensitive potassium channel. So answer of this question will be potassium ion. Answer of this question will be potassium ion. So oxygen sensitive potassium channel is there. Whenever there is hypoxia, hypercapnia, or acidosis, what will happen to this oxygen sensitive potassium channel? It will remain closed or open? Answer batao. Suppose I have given a question, a little twisted question. Whenever there is hypoxia, decreased partial pressure of oxygen. Whenever there is hypercapnia, okay, increased partial pressure of carbon dioxide, or if there is acidosis, what will happen to this oxygen sensitive potassium channel? It will be more open or it will be closed? Very good. So this channel is going to be inhibited in presence of hypoxia, hypercapnia, acidosis. Oh my god, सब कुछ तो पता है यार, सब कुछ जानते हो. Very good. Okay, be confident. हो जाएगा एकदम clear. Good. Okay. Now, maximum water reabsorption occurs in which part of the renal tubule? Only one thing. जैसे अभी आप बहुत अच्छे से आंसर दे रहे हो ना, why you are giving all the correct answer easily? Because you are now free. Your brain is not that much jammed. Your brain is not that much tensed. Okay, so exam hall is a different ball game altogether. Exam hall is a different scenario. So please try to remain cool in the exam hall. Try to remain relaxed in exam hall. Okay, if you are getting tense, okay, do a breathing practice. Slow deep breathing. Okay, okay. So that kind of cleansing breathing sometimes give you your relaxation of your parasympathetic system. Okay, so slow deep breathing. Okay, एक type box breathing pattern होता है, एक बार YouTube में देख लेना. So the box breathing pattern. So practice that breathing pattern. It will be very helpful even before your exam. If you are getting very tense or anxious, try to do practice a little bit of box breathing for 5 minutes. It will give you immense stimulation to your parasympathetic system. Your heart rate will be improved, your heart rate will be decreased, your blood pressure will decrease, you will feel relaxation. Yes, box breathing type 4. Count of 4, 1 2 3 4. Inhale, then hold for 4, then exhale for 4, and again hold for 4. So that is a kind of breathing pattern which is known as the box breathing. Practice it before your exam. It will be very helpful if you are getting anxious, because I can see all of you are giving correct answer. So if you are giving correct answer in a YouTube session, in this physiology session, so why not in the exam hall? Why you do mistake in the exam hall? Because your brain get cluttered with many things, your brain get tensed with many things. So try to relax that thing. Okay, so do practice a little bit. Now next one. So maximum water reabsorption occurs in which part of the renal tubule? So whenever this is the question, your answer will be PCT without thinking anything. So 65% of the water reabsorption occurs in the PCT, and this is irrespective of this water reabsorption in the PCT is irrespective of ADH secretion or not, irrespective of ADH hormone. So one thing you make it clear here, that ADH has a site of action. ADH increases water reabsorption, okay, up to 15 percentage, in which part of the nephron? Collecting duct. But even after the presence of the ADH, the maximum water that can be reabsorbed under the influence of ADH is how much percentage? 15 percentage only. Okay, so ADH can enhances your water reabsorption at the level of collecting duct. But even after the presence of the ADH, how much water reabsorption will be enhancing? Only the 15 percentage, not more than that. But at the level of PCT, how much water is going to be reabsorbed, whether the ADH is there or not? Around 65% water will be reabsorbed at the level of PCT. So I always say in my classes that question can be given like that: maximum water reabsorption occurs in which part of the renal tubule? ये क्वेश्चन का दो पार्ट, इन प्रेजेंस ऑफ एडीएच, इन प्रेजेंस ऑफ एडीएच, एंड इन एब्सेंस ऑफ एडीएच, इन एब्सेंस ऑफ एडीएच, दोनों का ये आंसर होगा पीसीटी पीसीटी. सो बॉटम लाइन इज दैट whenever you see ADH in a question, na, your brain try to answer collecting duct. But look at what they are asking. Are they asking ADH act on which segment of the nephron? Then collecting duct is the answer. ADH has receptor on which segment of the aquaporin? Then collecting duct is the answer. But is the question is asking that? Question is asking maximum water reabsorption occurs in which part of the tubule, in which part of the renal tubule, in presence of ADH. So whether the ADH is present or not, 65% water reabsorption is going to happen in PCT, and that is the maximum. That's why answer of any question, whether it is water reabsorption maximum, your answer is PCT. Okay, chalo. Now hormone increases during the period of the stress, starvation, and deep sleep. Only one answer possible, that is the growth hormone. Other answer is not possible in this question, because to clarify this thing, I have kept that sometimes growth hormone and prolactin, ये दोनों hormone का stimulus is very important for your MCQ. So for growth hormone, look at the stimulus, try to remember all of them. Growth hormone is stimulated any condition if it is hypoglycemia. So if a person is doing starvation or fasting or exercise, there will be increased growth hormone secretion. If there is increase amino acid in your blood plasma, in your blood or plasma. That means if you are taking a huge protein rich meal, then also your growth hormone secretion will be increased. If you are any kind of stress, whether that is surgical stress or mental stress or physical stress, then also it is going to increase your growth hormone. Or if you are sleeping, which stage of sleep? Deep sleep stage. Deep sleep means that is the stage 4 or the N3 stage of the non-REM sleep stage. But REM sleep, all of you know, REM sleep is not considered as a deep sleep. It is a kind of sleep where the the rapid eye is moving. So that rapid eye movement sleep is inhibitory for the growth hormone secretion. But look at on the other side, REM sleep is a stimulus for prolactin hormone secretion. So this difference you have to remember. Yes, okay. कॉर्टिजोल नहीं होगा, कॉर्टिजोल में ये डीप स्लीप इज नॉट ए स्टिमुलस. कॉर्टिजोल क्या होता है? मॉर्निंग में ज़्यादा सिक्रेशन होता है. कॉर्टिजोल, ये जो डीप स्लीप है ना, ये डीप स्लीप इज रिमूविंग द कॉर्टिजोल. Okay, because deep sleep, you know, cortisol has circadian pattern. Cortisol is maximum secretion in the morning, and in the night cortisol secretion depends. So that's why cortisol is not going to be answer of this question because of the deep sleep. Am I clear, beta? Okay. यस, कॉर्टिसोल डीप स्लीप में डिक्रीज हो जाएगा ना बेटा. कॉर्टिसोल इंक्रीज होगा अर्ली मॉर्निंग में 8:30 AM इन द मॉर्निंग. सो दैट्स वाई कॉर्टिसोल भी आंसर नहीं होगा. इसलिए मैं बोल रहा हूँ इसका आंसर एक ही हो सकता है, दैट इज योर ग्रोथ हार्मोन. बिकॉज इवन इफ यू लुक एट द डीप स्लीप इज नॉट ए स्टिमुलस फॉर प्रोलैक्टिन ऑल्सो. रेम स्लीप इज ए स्टिमुलस फॉर प्रोलैक्टिन हार्मोन सिक्रेशन. ओके, एंड ये मैंने दोनों कलर में क्यों दिया? क्योंकि this number 1 to number 4, these are the specific stimulus for prolactin only. These are not the stimulus for the growth hormone. But this 5 and 6, these are the similar to this 1 2 3 4 of the growth hormone. So some of the stimulus are common for growth hormone and prolactin. That's why the confusion arises, like hypoglycemia, like stress. They are common for both growth hormone and prolactin. But sleep, whenever I say deep sleep, I am talking about the non-REM sleep stage 4 or N3 stage. That is not a stimulus for the prolactin. Prolactin is stimulated by REM sleep. Getting my point? So that's why, yes, non-REM sleep is a stimulus for growth hormone, and REM sleep is a stimulus for which hormone? REM sleep is a stimulus for prolactin. Not only that, REM sleep also stimulate LH and FSH. REM is also a stimulus for LH hormone and FSH hormone. Am I clear? Okay. So ये ध्यान रखो. Okay, चलो. Next one. What are the characteristic feature of primary hypothyroidism? So whenever I say primary hypothyroidism, yes, beta, prolactin has a long list of stimulus. Okay, so that long list you can read in Harrison. There is a long table given, even stimulation on the chest wall. Okay, and the things that you have written, the sexual intercourse, everything is a stimulus for prolactin secretion. Okay, so what are the characteristic feature of primary hypothyroidism? So whenever I say primary hypothyroidism, then you have to think that your thyroid gland is at problem. Thyroid gland is destroyed. Okay, so if the thyroid gland is destroyed, directly there will be decrease in the T4 secretion. Whenever there is T4 secretion decreases, because the negative feedback is lost, so that's why TSH and TRH both will be increased in this condition. That is primary hypothyroidism. Okay, and whenever I say secondary hypothyroidism, then you have to think of hypothalamus pituitary thyroid. Secondary means problem is not at the level of okay, problem is not at the level of thyroid gland, but the problem is at the level of pituitary gland. So pituitary gland is producing which hormone? So first thing that is going to be decreased here is the TSH. Because the TSH is low, what will happen? The T4 is also going to be low. But because the T4 is low, TRH will have less negative feedback, so TRH is going to be increased. And whenever I say tertiary hypothyroidism, okay, so here your hypothalamus is destroyed, here your hypothalamus is damaged. So whenever the hypothalamus is damaged, the problem is going to start from here. The TRH secretion will be decreased first. Because the TRH secretion is low, what will happen to the TSH secretion? TSH is also low. What will happen to the T4? T4 is also low. So please remember that whenever I say that the person is suffering from hypothyroidism, you are absolutely sure T4 is low. T4 is low in all these conditions. That's why hypothyroidism. But look at the value of the TSH and TRH. If all are low, then that is a tertiary hypothyroidism. All are low, tertiary hypothyroidism. If only first two are low, but third one is high, that is secondary. If only first one is low, baki two high, that is a primary hypothyroidism. Remember like this. Okay, so please remember this important thing. Okay. Yes. Chalo. Now, hormone responsible for the growth of the breast tissue. So, if this is the question, that hormone responsible for the growth of the breast tissue, okay, this is the question in lactating mother or in pregnancy. पहले ध्यान दो कि क्या पूछ रहा है. Hormone responsible for the growth of the breast tissue. All three hormones are important. But if I ask you that development of the breast or the growth of the breast tissue during pregnancy, then your answer is estrogen, progesterone is main. But whenever I'm saying lactating mother, then your main answer is going to be prolactin, because all of you know that the nursing mother, whenever the baby is suckling the areolar region, there will be a positive feedback system where oxytocin is going to cause ejection of the milk, and in that condition prolactin secretion will be also higher, and prolactin is the main hormone in lactating mother for the development of the breast tissue. But if the question is for the development of the breast in pregnancy, then your answer will be the estrogen and progesterone. ठीक है, चलो next one is all the single important liner are done. Someone was asking ki how long this class will continue. Maybe more 30 minutes are required, 30 to 40 minutes maximum is required, because now we have done the single liner question. They are the most important, I told you, and the major part of the class was this single line. Okay, now certain important image that are coming in your exam recently, those important images. So obviously without discussion of the action potential images, nothing is complete. Physiology is never complete basically. So in action potential image, all of you know that x-axis is the time axis and y-axis is the membrane voltage axis. Okay, so this is the membrane voltage axis. Okay, so in the action potential, if you look at this diagram, so first part of this action potential, this is known as the local potential. I believe all of you remember. So this is local potential. Then you are getting a phase where the membrane voltage is suddenly rising in the upward direction. This is known as the depolarization phase of the action potential. So this is depolarization, and I hope all of you know that the depolarization phase of action potential is due to influx of sodium through which type of channel? Through voltage gated sodium channel, that is Na.V, right? And after the depolarization is done, you know that there is a phase where the membrane voltage is going down and then reaching to the RMP. Okay, then this phase is known as the repolarization phase of action potential. Repolarization phase of action potential is efflux of potassium ion from the cell, and there will be also inactivation of the sodium ion. Now there is a particular phase here. This is known as the after hyperpolarization. After hyperpolarization phase. Okay, after hyperpolarization phase. Okay, now apart from this, sometimes in the action potential diagram, okay, you may get an image based question where you will be getting three similar type of image like this. Three similar type of image you are getting. So one is this. Okay, suppose you are getting three lines like this, another line like this, and then you are getting another line like this, and now you are getting a little bit confused. Suppose they're asking identify which of the three line is an action potential, which of them are the potassium, and which of them are sodium. Okay, ये अच्छे से नहीं हो रहा है. Okay, so if this is the thing, then first of all you try to understand which one is the membrane potential or which one is the action potential. So membrane potential or action potential, it will go in the positive direction also, it will go in the negative direction also. By identifying this, you'll be able to identify that this is the change of membrane potential or action potential. Okay. Now, one line I can see here, it is rapidly going up and rapidly going down. This is the sodium channel. This is the sodium channel opening and inactivation. Sodium channel opening and inactivation. So please remember that this is known as the, okay, permeability curve of sodium. Permeability curve of sodium. Sodium permeability. Sodium channel number opening happens with rapid manner, and closure of the sodium channel also happens with rapidity. So sodium channel closure, sodium permeability. And this blue color curve, this is the curve which is known as the potassium permeability curve, potassium permeability curve. Okay, so these are the action potential image that you should remember. Okay, so if I ask you potassium permeability is maximum which point, so just follow this curve and find out where it is getting maximum, where it is getting maximum. That is the maximum potassium permeability. And maximum sodium permeability, here is the maximum sodium permeability. This first curve is the membrane potential, action potential curve na, that is the membrane potential, membrane voltage change. So this is my action potential curve. The first curve is the action potential curve. Okay, the second curve is the permeability curve of sodium, and the third curve is the potassium permeability curve. Okay, so sodium permeability curve means how many sodium channels are open on the neuron at any point. So initially sodium channel numbers are very less, suddenly sodium channel numbers are very huge, and then sodium channel are getting inactivated. This is the meaning of the sodium permeability. Potassium channel is a slow channel. It is opening in a slow manner. Number of potassium channel opening is rising, and then the number of potassium channel opening is decreasing, and then it is 0. So this is the meaning of this 3 curve. Okay, next MCQ. So this is based on the pressure volume loop. So pressure volume loop, why I have kept it here, because I believe all of you know that thing. But in this pressure volume curve, पहले तो आंसर कर लेते, point C denote. So point C is what and point A is what? पहले बताओ, point C is what and point A is what? So point C is basically your, okay, opening of semilunar valves, opening of semilunar valves, and point A is for opening of AV valves. Okay, so obviously लेफ्ट वेंट्रिकल में है तो आउटिक वाल्व होगा, ओपनिंग ऑफ सेमिलर वाल्व आंसर होगा, ये तो ठीक है. But whenever this same PV loop is given and they ask you that first heart sound and second heart sound occurs at which point, first heart sound and second heart sound occurs at which point, in today's class we have discussed that first heart sound means this is the beginning point of the isovolemic contraction phase. So this is my first heart sound origin point, and point number D, this is the second heart sound origin point. I believe all of you know that this pressure volume loop का ये जो part है from B to C, this is which phase of cardiac cycle? B to C. If I ask you from B to C, which phase of cardiac cycle? This is, look, देखो क्लोजर एंड ओपनिंग से बताओ, ऑलरेडी हम लोग डिस्कस कर चुका है. बी सी इज व्हिच फेज ऑफ द कार्डियक साइकिल? बी सी इज द isovolemic contraction phase of cardiac cycle. And what about this? The D2A. So D2A is isovolemic relaxation phase of cardiac cycle. So isovolemic contraction and isovolemic relaxation. So this is the bottom line of the PV loop that you have to remember. Okay. So एक बार बोल देते हैं quickly. From A point to B point, this is the filling phase of cardiac cycle, followed by the ventricle is contracting isovolemically. So isovolemic contraction. Then the ventricle is ejecting blood. So this is the ejection phase of the cardiac cycle. Then the ventricle is going for relaxation without any change in volume. So this is the isovolemic relaxation. And again the ventricular filling will start, filling phase. Okay, ये हो गया. Next one, देखो ये Uyghur's diagram. Okay, so in Uyghur's diagram, it's a very complex diagram. बट ये कॉम्प्लेक्स डायग्राम को धीरे धीरे एक बार सिंप्लीफाई कर लेते हैं. व्हाट द प्रेडिक्टेड क्वेश्चन दैट वी आर गोइंग टू सिंप्लीफाई हियर. ओके, सो एकदम ये डायग्राम का सबसे पहले लुक एट द बॉटम 2 लाइंस ऑफ दिस डायग्राम. सबसे नीचे जो दोनों लाइन है उसको देखो. सो आई बिलीव यू हैव आइडेंटिफाइड दैट दिस इज नथिंग बट द रिकॉर्डिंग ऑफ व्हाट, दिस इज नथिंग बट द रिकॉर्डिंग ऑफ द ECG. ओके, ECG. And then just above the ECG recording, the heart sound recording has also been given. This is S1 heart sound, this is S2 heart sound, this is S3, this is S4. So first thing you remember that along with ECG, if you record the heart sound, your first heart sound, the S1 will correspond with the R wave in the ECG. Okay, your S2 will correspond with the T wave ending of the ECG, T wave ending of the ECG. Your S3 will corresponding in the TP segment of the ECG, TP segment of the ECG, and your S4 will correspond with the atrium contraction, that is the P wave in the ECG, P wave in the ECG. Okay, so these are the bottom line you have to remember from the Uyghur's diagram. Okay. Now next is that look at the ventricular pressure changes. So in this curve, the solid line, where the solid line is, okay, solid line is this. So this solid line is rising to a very high level, and then this solid line is decreasing to a very low level. This is typically the recording of the ventricular pressure. So this is typically the recording of the ventricular pressure volume. So this is ventricular pressure curve, right? And then if you look at this, then this is another recording where the pressure is not going to a very low level. This is typically the pressure change at the level of aorta. So this is your aortic pressure. Aortic pressure. Okay, aortic pressure change. And you are also finding out another broken line here. This broken line is, as you follow here, so this is another broken line. Okay, so here in this broken line you are getting certain positive wave, A wave, C wave and V wave, and you are getting some downward pressure wave, like this is X and this is Y. So this is typically of the JVP kind of wave, but in left ventricle we do not record JVP, but this broken line that I have discussed here, this is nothing but your atrium pressure. So this is nothing but your atrium pressure recording. Okay, so sometimes this image can be given and they may ask you just simply identify which one is the ventricular pressure, which one is the aortic pressure, or identify which heart sound this is along with ECG and heart sound recording. But the more important thing is that which event is happening after what, that sequence you should remember. So please remember like this, the sequence a little difficult. P wave, P wave is the atrium contraction. So after the appearance of the P wave, atrium contraction is going to happen. So P wave is the atrium depolarization. After atrium depolarization, there will be atrium contraction. Whenever atrium contraction occurs, A wave in the JVP will be produced. After the A wave, the S4 heart sound is going to be produced. So these are in sequence. एक के बाद और एक आएगा. Okay. Then QRS complex. QRS complex is ventricular depolarization. Whenever ventricular depolarization occurs, there will be onset of ventricular systole. And I told you repeatedly, immediately after ventricular systole, heart sound that you are going to be produced is S1 heart sound. And after S1 heart sound, C and X wave in the JVP will be produced. Then T wave. T wave is the ventricular repolarization. Repolarization means it is going to cause a relaxation of the ventricle, and at the beginning of the isovolemic relaxation S2 will happen. So T wave के बाद S2 होगा, and S2 always correspond with the dicrotic notch. So if you look at this previous diagram, Uyghur's diagram, so this pink color line is the aortic pressure curve. In aortic pressure curve, if you look at the aortic pressure curve, it looks like this. Okay, so there is a notch here. This notch corresponds with the S2, and this notch is known as the dicrotic notch in the aortic pressure curve. This is known as the dicrotic notch. S2 के साथ जो आता है, ठीक है? So you got dicrotic notch. Then you are looking at the V wave in the JVP. इसके बाद it will S3 will appear, and after S3 Y descent in the JVP is going to appear. So little difficult. At least you remember this three sequence first, very important. So ये sequence क्या देगा? Which of the following sequence is correct? This kind of question they will be given. So try to remember this sequence from the Uyghur's diagram. Okay. Now the next image, I believe all of you can answer, but before answering, you have to remember that this contraction at the contraction at the proximal part. So this is the contraction of the proximal part. This is done by neurotransmitter ACH and substance P. This is more vital MCQ, and you know that there will be relaxation in the distal part. Distal part relaxation of the distal part will be done by which one? Vasoactive intestinal polypeptide, nitric oxide. These are the two main, although adenosine triphosphate is also there. So answer is peristalsis. There is no problem, but you have to remember this VIP and nitric oxide. Okay, so ये न्यूरोट्रांसमीटर का नाम याद कर लो. Okay, next देखो, whenever peristalsis is given as an images, So they can also give you segmentation question in image formation also. So segmentation movement of the GIT is also known as the pendulous movement of the GIT. Pendulous movement of the GIT, where food particle, food bolus, suppose this is the food bolus, it will be fragmented into distal part also, it will be fragmented into proximal part also. Then this same food bolus will be again reaching at the center part like this. Okay, both are coming to the center, and again it will be fragmented to the proximal part in the distal part. This kind of movement of the food bolus is known as the pendulous movement. Okay, पुराना जमाना में जो pendulum होता था ना wall clock का, so that pendulous of the, okay, so this is a pendulous kind of movement, and this segmentation movement is responsible for digestion and absorption of the food. So this is responsible for, this is helpful for digestion and absorption of the food particle, because for digestion you have to cause a small fragment of the food bolus. So that fragmentation of the food bolus, the churning of the food bolus, and the mixing of the food bolus with the enzymes is done by this segmentation process. Okay, and apart from this peristalsis and segmentation, there is a motility in the GIT which happens in fasting condition, fasting stage motility. And this fasting stage motility is again an important for, okay, again an important for MCQ. This motility is known as the migratory motor complex. Yes, but I believe that you have read a detailed version of this from the main lecture. It has 3 phases, but those phases are not very important. But if it is given as an image-based question, how to identify that this is the migratory motor complex? So migratory motor complex means there will be contraction of a part of the GIT. That's a very strong contraction, and this contraction will move from one segment of the GIT to the other segment, particularly start from the mid part of the stomach, and it is moving from stomach, then maybe duodenum, maybe jejunum, in this way. So if the segment of the intestine is given, suppose this is the duodenum, okay, this is the jejunum, this is the ileum, and you are getting an image like this where you are getting activity. This is the muscle contraction activity, and again a muscle contraction activity. In between these two muscle contraction, you are getting no activity of the muscle, means between two migratory motor complex contraction, okay, between two migratory motor complex contraction, there is a time gap. This time gap is approximate 90 minutes. So please remember, migratory motor complex appear at an interval of, this is an MCQ, 90 to 120 minutes, 90 to 120 minutes. So migratory motor complex start from one part and then it moves to the other part of the intestine in a sweeping manner, as you can say. Okay, so it is moving from one part to the other part. That's why you are getting that if it is happening here, it is not happening in the second part here. Okay, it is happening in a little bit shifted way. So this is the meaning of shifting motility from one part to the other part, and there will be a time gap after appearance of the 1 MMC. So this is 1 MMC migratory motor complex, this is another MMC. In between 2 MMC, what is the time gap? 90 minutes is the time gap. And migratory motor complex is under the control of one hormone, and that is motilin hormone. So please remember this motilin hormone for migratory motor complex. 90 to 120 minutes, 90 to 120 minutes, that is the answer. Okay, if you have to choose one, so 90 is the answer. Okay, chalo. Now another image, I believe this is the last image, important image, cystometrogram. So here in cystometrogram, you can find out that in the x-axis there is a volume inside the urinary bladder, and in y-axis you are getting the pressure inside the urinary bladder. So these are the pressure in the urinary bladder. Okay, so initially there is a little increase in pressure, then there is a plateau phase. So this plateau phase means segment 1B. 1B is the segment where the volume is increasing. The volume is increasing inside the urinary bladder. The wall tension is also riding inside the urinary bladder, but pressure inside the urinary bladder is remaining constant. Pressure inside the urinary bladder is remaining constant. This is application of which law? This is the application of Laplace law. What is Laplace law? Laplace law is saying pressure P is equal to twice T upon R. Okay, twice T upon R. So whenever the volume is increasing inside the urinary bladder, more the volume, there will be expansion of the radius of the urinary bladder. So what will happen to the radius of the urinary bladder? It will also increase. So when the radius is increasing, parallelly the wall tension is also increasing. So in a ratio, if the numerator and denominator both are rising proportionally, what will happen to the pressure? The pressure will remain constant, and this constant pressure is seen in this segment number 1b. That's why this is a very important segment for MCQ. This is the segment where Laplace law is applicable. Not only that, the plasticity property of smooth muscle is also applicable in this segment. Plasticity property means if you stretch the urinary bladder, okay, the smooth muscle of the urinary bladder will take the new shape. Okay, if you stretch the skeletal muscle and release it, skeletal muscle will come back to the original position. Okay, that is elasticity property. But smooth muscle, if you stretch it and keep it for some times, it will maintain the new shape. So this changing shape property is basically the plasticity property that is happening in 1b segment of the systematogram, right? And if I ask you, what about this segment number 2? What about this segment number 2? So segment number 2 means we can easily see that there is sudden increase in pressure in the urinary bladder. So here you have to remember one volume, that is 400 ml of urinary bladder volume. So if your urinary bladder is having 400 ml of volume, so then you cannot listen this class. You have to go to washroom. Otherwise, what is going to happen? There will be onset of micturition reflex, and as you understand, micturition reflex onset हो जाएगा तो लग जाएगा आपका गीला हो जाएगा सब कुछ. So this is the scenario which is happening in phase 2. So phase 2 means onset of micturition reflex. Okay, plasticity elasticity is not equal, beta. Elasticity is, I told you that in skeletal muscle there is a property, if you stretch it and then if you stretch it and then if you relax it, it will come back to the original position. Okay, a little bit. That is because of the presence of the titin molecule and the extracellular matrix protein and the connective tissue in the skeletal muscle. Okay, cardiac muscle also has a little bit of property like this, that is known as the elastic property. So elasticity is a property to the returning to the original shape. That is the property of elasticity. Elasticity means if you distort the shape of a structure, the property of returning to the original shape is known as the elasticity property. But smooth muscle is different. If you stretch the smooth muscle, it will take the new shape. Like for example, blood vessels. If there is hypertension, for long duration, the smooth muscle of the blood vessel, they will be relaxed in the new condition. If the more blood pressure, so there will be stretching of the smooth muscle of the blood vessel. So the blood vessel will be dilated. And whenever the blood vessel is dilated, the blood pressure will again normalize. That is one of the mechanism how the smooth muscle is adjusting the high blood pressure inside your body. Okay, by the property of plasticity. Okay, so that is basically the property of the smooth muscle, not the property of the skeletal muscle. Got it? Okay, chalo. Another important images which have recently been asked, identify the breathing pattern shown in these images below. So which kind of breathing pattern this is? This is very famous breathing pattern, all of you know. Broken line indicate when the muscle tear is going to happen. If you don't allow the micturition to happen, okay, so muscle may tear out. That is the broken line. Yes, so this is basically typically of chain stroke breathing. So you have to remember certain breathing pattern, and in this table I have given this chain stroke breathing pattern and this biot breathing pattern. These are the two important. So chain stroke में क्या होगा, हम लोग बोलते हैं कि there will be a crescendo and discrescendo pattern. So there will be gradual deepening of the breathing, then gradual, okay, and then there is an apnea, and again there is gradual increase and gradual decrease in the depth of the breathing. Crescendo discrescendo pattern type of breathing. Okay, so this is gradual increase, gradual decrease, gradual increase, gradual decrease, again gradual increase, gradual decrease. In between these two, there will be a phase where the apnea is going to happen. This is typically of chain stroke breathing pattern. Okay. And in Byrd's breathing, there is irregular kind of breathing. Irregular breathing here, there is another irregular breathing phase here. In between these two irregular phase, there will be an apnea phase. So this is a kind of Byrd's breathing. Okay. बाकी जो है ये आप देख लेना बाद में, बाकी सब you know, but this chain stroke breathing and this Byrd's breathing, these are the two important things that you have to remember. Okay. Apart from that, I believe all of you know that normal breathing pattern is known as the eupnea breathing. Okay, so this is a normal breathing pattern. When only the rate is higher than normal, but the depth is normal, that is tachypnea. When only the rate is low, that is bradypnea. When only the depth is higher, that is hyperpnea. So tachypnea and hyperpnea के बीच में difference is that tachy is related to the rate. Rate of breathing is high, tachypnea. And depth of the breathing is high, but the rate is normal, that is hyperpnea. And when both rate and depth both are high, that is Kussmaul breathing pattern. Okay, rate and depth both are high continuously. So this is typically of Kussmaul's breathing pattern. Okay, so last three जो breathing pattern ये box में देके रखा है, they are the basically the abnormal type of breathing pattern you have to remember for your exam. ठीक है, important. चलो. Okay, now next one is basically a recent question, and I believe this is a difficult question for FMG exam. Strength duration curve, but you cannot trust them. Okay, they can give any kind of question, so you have to be prepare a little bit. Okay, so see there in this graph. Okay, I'll explain first. So in this graph, okay, x-axis it is written that this is the stimulus duration, and y-axis it is written stimulus strength, means voltage. So basically this graph explain the stimulus voltage and stimulus duration of the stimulus and voltage of the stimulus. Okay, and here you can find out one curve. So in this curve you have to first find out which one is the lowermost point. What I told, first you find out which one is the lowermost point in this curve. Lowermost point in this curve, आप पहले इसको ढूंढो. So if I follow this curve, this is very high point, means high voltage. So I'm going down. So I can find out here, this is the lowermost point. Okay, so now I got the lowermost point. Okay, now whenever I got the lowermost point, from that lowermost point, I'm going to drop on perpendicular. I'm going to drop on perpendicular on x-axis. Okay, sorry, y-axis. So I'm going to drop on perpendicular on y-axis. Okay, so the point where this perpendicular is meeting at the level of y-axis, this point will be known as the point of chronaxy. This point is known as the point of Riobes. This point is known as the Riobes. So Riobes is a point on y-axis. So this is a voltage or duration. If I ask you, this is the voltage of the stimulus or duration of the stimulus? Voltage, because y-axis में क्या मिलता है? Voltage मिलता है. If in this curve, what is in y-axis? Voltage of the stimulus. So the minimum voltage from this curve that I am getting, that minimum voltage is known as the Riobes voltage. So the minimum voltage which is required to produce action potential in a tissue, that minimum voltage is Riobes voltage. Okay. Now suppose you told that Riobes voltage, you got it. How much is the Riobes voltage? Now what is the duration of this Riobes stimulus? So duration आपको कौन सा axis में मिलेगा? Duration you are going to find out in which axis? X-axis is the duration. So you have to drop another perpendicular on x-axis. So this is the duration. So this is the minimum duration for a Riobes voltage. And this minimum duration for a Riobes voltage is known as the utilization time. Am I clear? Okay. So Riobes and utilization time आपको मिल गया. लोअर मोस्ट पॉइंट को देखना होगा. लोअर मोस्ट पॉइंट से यू ड्रॉप ऑन परपेंडिकुलर ऑन वाई एक्सिस, दैट इज रियोबेस. ड्रॉप ऑन परपेंडिकुलर ऑन एक्स एक्सिस, दैट इज क्रोनैक्सी. दैट इज यूटिलाइजेशन टाइम. एब्सोल्युटली सॉरी. नाउ फॉर द क्रोनैक्सी, बार बार क्रोनैक्सी रहा बिकॉज क्रोनैक्सी इज मोर कॉमन. Now, whatever voltage you have got at point number B, okay, great, great, dear Dr. Naved, thank you so much. It gives me immense pleasure that you have passed. Congratulations and thank you so much. Chalo, ab dekho. Now, whatever voltage you got at point number B, suppose that is 2 voltage, 2 millivolt. Now you have to double this 2 millivolt multiplied by 2. You have to double it. Or suppose at point number B, you have received that this is 3 millivolt is the minimum voltage. Multiply this with 2, twice Diobase voltage. So this is the point number C. This is the twice Diobase voltage. Although this is not twice because ये थोड़ा सा ऊपर होना चाहिए, ये थोड़ा सा ऊपर ऐसे होनी चाहिए, because if this is the 2 millivolt or 3 millivolt whatever, if I double it, it will be near equal to here. So this curve is a little wrong. So actually this point should be here. Okay, but anyway. So whenever I make a doubling of this Diobase voltage, okay, then I have to find out that how much time I require for double Diobase voltage to produce one action potential. So from this double Diobase voltage, I am dropping on perpendicular on this curve, and that curve I am projecting on the x-axis. Okay, so from this double Diobase, what I did, I have dropped on perpendicular on this curve, and that curve I have extended on A, and this A is known as the chronaxy. So by definition, chronaxy is also a time like that of the utilization time. But दोनों के बीच में difference is that whenever you are calculating the time for Diobase voltage, that time is known as the utilization time. And whenever you are finding the time for double the Diobase voltage, that time is known as the chronaxy time. Am I clear? Am I clear? Okay, अब अभी समझ में आया? So utilization time means whenever you are measuring the time of minimum strength of stimulus, that is the Diobase stimulus, and chronaxy is whenever you are finding the time of double the Diobase voltage stimulus, right? So this way you can easily answer that B is the Diobase in this curve, D is the utilization time of this curve, and A is the chronaxy in this curve. A is the chronaxy in this curve. So option D is going to be the correct answer in this question. समझ में आया? ओके, ये डिफिकल्ट है, इसलिए मैंने बोल रहा था ना ये डिफिकल्ट है, बट आपको ऐसे करके ही समझ में थोड़ा सा आना चाहिए था. ठीक है, चलो. Now the next image here is a very simple image. We have already discussed it. So if you look at this image, you can easily see here that this is Sertoli cell, and Sertoli cell is inhibiting the FSH. So we have already repeatedly discussed that Sertoli cell inhibit FSH by production of inhibin hormone. So ये हो जाएगा हमारा inhibin, and यहाँ पे हमारा हो जाएगा testosterone hormone. Okay, and Leydig cell is producing testosterone. So simple. And this kind of simple question is generally given in your exam, not very difficult. Okay, but कभी कभी वो chronaxy Diobase आ जाता है, that become difficult. So this is the same thing that I just told, that Leydig cell produces testosterone, and testosterone has negative feedback on anterior pituitary for LH production, and FSH has stimulation on Sertoli cell produce inhibin, and inhibin has negative feedback on anterior pituitary for FSH. Okay, and similarly there is a in female reproductive cycle, FSH is stimulating the granulosa cell. So FSH is stimulating the granulosa cell is producing inhibin, and that inhibin has negative feedback effect on anterior pituitary for FSH production. And same way, LH is stimulating the theca cell is producing progesterone, and that progesterone is giving negative feedback. Some of the androstenedione, some of the androgen of the theca cell will go to the granulosa cell, and with the help of the aromatase enzyme, it will be converted into estrogen, and estrogen also has negative feedback at the level of anterior pituitary. Okay, so this sequence, this flow chart, you try to remember. Maybe it can be given as an MCQ. Okay, so ये हो गया हमारा important images. In LRR इससे ज़्यादा possible नहीं होगा, so please excuse me for that, but इससे ज़्यादा possible नहीं होगा because time we also have to maintain. Okay, now few mathematical problem. So one of the important mathematical problem which is generally given in your question on based on the Hagen-Poiseuille equation. So all of you know, according to this Hagen-Poiseuille equation, resistance of any blood vessels or resistance of any tube is basically 8 eta L pi r to the power 4, pi r to the power 4. We generally write the question of resistance like this. So basically I have to remember that the resistance is inversely proportionate to the radius to the power 4. Okay. So if you look at this question is there is reduction of radius to 1/3. So always understand like this, that if my original radius is r, so after reduction, okay, after reduction the radius is 1/3 r. So just I have to put this 1/3 r into this formula. So 1/3 upon r to the power 4. So this will be obviously 3 to the power 4. So this is 81 times. 81 times. So whenever there is reduction in the radius, if the reduction is only 50% reduction, 50% reduction, then I'll do like this to the power 4. Means it will be 16 times increase in radius resistance. But whenever this is 1/3 of the original, then it will be 81 times based on this Poiseuille-Hagen law. Okay. Okay. Next is, already question has been given based on Starling forces. So Starling forces you can calculate based on these forces at the level of capillary, or the GFR force calculation can also be done. Okay. So whenever the blood is flowing in the capillary and blood is going out of the capillary, all of you know that there is a pressure which is denoted by letter P. P letter stands for hydrostatic pressure. Okay. So hydrostatic pressure of capillary, suppose this is the hydrostatic pressure of the capillary, PC is exerting an outward force from the capillary towards the interstitial tissue. And if I say hydrostatic pressure of tissue, PT, that is a force which is trying to push the water into the capillary compartment only. And there is another force which is denoted by pi. Pi is oncotic force. Oncotic force is basically due to plasma protein. Oncotic force of capillary, oncotic force is always a kind of retaining force. So oncotic force of capillary is trying to drag water from the tissue space, and oncotic force of tissue, oncotic force of tissue is trying to drag water from the capillary. So if I ask you, calculate what will happen to the net force from capillary towards the tissue space. So the net force will be PC minus PT. PC minus PT plus pi T is helping and pi C is opposing. So this force formula is known as the Starling force formula. Okay. Flow भी change होगा. Flow is inverse. Okay. So in this question you are asking flow ना. So flow basically based on this Ohm's law. Ohm's law ना. Ohm's law हम लोग जानते हैं ना. V is equal to IR. So जब भी resistance change होगा, this flow is basically I. So I is basically the flow. So I is inverse of R. So जब भी resistance increase होगा तो flow decrease होगा. That is the thing. Okay. So you please remember this formula. So this is known as the Starling force formula. By this formula, you can also calculate the force, net force for GFR, net force for GFR. How it is calculated? This is equal to PC, that is the glomerular capillary, minus PB, Bowman's capsule hydrostatic pressure, plus pi B, Bowman's capsule oncotic pressure, minus pi C, capillary oncotic pressure. If you apply this formula, this is the formula which is at the level of Bowman's capsule or glomerular filtration rate, and the net force is 10 millimeter of mercury. Normally the net force is 10 millimeter of mercury. You are absolutely correct. Bowman's capsule, I am putting pi B, but pi B will be 0 in normal cases. But suppose a question has been given, a person is suffering from nephrotic syndrome. Okay, Bowman's capsule oncotic pressure is 10 millimeter of mercury. Then how are you going to apply this formula here? Then you have to look at this formula now. So that's why I've kept it here. You know that pi b normally is 0. Well and good. I did not say that this is some number. Pi b is normally 0. But if the question is given that a patient is suffering from nephrotic syndrome, now the Bowman's capsule oncotic pressure is not 0. In that cases, they may give you a number that calculate the net force of filtration or GFR in this patient. Then you have to take help of this formula, right? Right. So please remember. So oncotic, matlab, you just remember the whole formula. Then you look at what is given, what is the hydrostatic pressure of capillary, what is the hydrostatic pressure of Bowman's capsule is given in the question. Oncotic pressure of Bowman's capsule has been given in the question or not. If it is not given, so take it as a 0, because normally the protein is 0 in the level of Bowman's capsule, almost 0. Okay, and oncotic pressure of the capillary normally it is 32, but whatever is given you have to take. Okay, ठीक है, चलो 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 चलो, okay, हो गया, चलो. Next one, cardiac output calculation. So cardiac output calculation, if it is given, it will be given based on the fixed principles or okay. So according to this fixed principle, cardiac output is equal to oxygen consumption of the whole body upon your arterial oxygen minus venous oxygen, artery venous oxygen difference. Okay. Okay, so now you look at, so oxygen consumption, which is measured with the help of spirometer, is given here as 240. Arterial blood oxygen content is given 20 ml percentage. This means this is 20 ml per deciliter of blood, 100 ml of blood. That means I have to convert it into ml. So this is 0.2 ml per ml of blood. And then it is given 15. So this is 0.15 ml per ml of blood, Now you put into this equation. So this is 240 upon 0.2 minus 0.15. Calculate it and tell me the answer. Most probably this will be 4800. Calculate for and tell me the answer. 4800 ना, ठीक है, 4800 ml. So this is 4.8 liter. 4.8 liter. Good. चल ठीक है. Okay. नेक्स्ट इज दैट, ये हो गया बेसिकली मैथमेटिकल इक्वेशन, मैंने ज़्यादा नहीं रख पाया. सो नाउ टू इम्पॉर्टेंट टेबल्स आई विल शो. ओके, टू इम्पॉर्टेंट टेबल. So first important table is regarding SGLT and GLUT. So this SGLT and GLUT, so SGLT1, SGLT2, these two are the secondary active transporters. So never forget where they are located. Secondary active transporter. All the SGLT are secondary active transporter and all the GLUT they are the facilitated diffusion. Okay? So remember. ओके, सो मैथमेटिक्स ज़्यादा नहीं चाहिए, जितना है इतना ही करो, मोर देन इनफ. ओके, इतना ज़्यादा नहीं चाहिए. सो SGLT1 and SGLT2 में द बेसिक डिफरेंस यू हैव टू रिमेंबर. इफ द क्वेश्चन इज अबाउट द GIT, then it is only SGLT type 1, and if it is a question of kidney, then both SGLT2, that is the main, and SGLT1 is also there, but that is not that important. Okay, so 90% glucose reabsorption is done by SGLT2, only 10% reabsorption is done by, okay, only 10% is done by SGLT1. So remember the mainly the SGLT2. Okay, the other GLUT that you have to remember, we have already discussed this SGLT2 and SGLT4. So they are important, but apart from this, I believe you all know that GLUT5 is also important. Why GLUT5 is important? Because although the name of this GLUT is GLUT5, but this is a basically fructose transporter, and where they are located, the intestine fructose transporter and the fructose transport in sperm membrane. So these are important. Okay, so SGLT GLUT are very important, remember. And the last one, last table for today, or last for today. So nerve fiber classification: A fiber, B fiber, C fiber, all of you know. Try to remember as many information as possible from this table. But if you don't want to remember everything, at least remember A alpha fiber where they are located. Question will be given like this, that proprioceptive fiber where they are located. So proprioceptive fiber are located mainly at the level of the proprioception and motor fiber. They are mainly A alpha type of fiber. And what is the conduction velocity? 70 to 120 meter per second. Same way, okay. A beta fiber for pressure and touch. A gamma and A delta fiber where they are located, everything is written in this table. Now only one thing I will make you understand here, that is A delta and C fiber. A delta and C fiber, both of them are for pain and temperature, but pain which is known as the fast pain is by A delta fiber, and pain which is the slow pain, that is by C fiber. ठीक है? Okay, ये table. Now from this table, certain important question. What are the important question? Cold sensation is carried by which type of fiber? So this is A delta fiber. And warm sensation, burning pain, freezing pain carried by C type of fiber. ठीक है? Okay. Local anesthesia, most sensitive fiber. Confusion is there, but follow this whatever is written. A gamma, A delta, followed by A alpha, A beta, followed by B fiber, followed by C fiber. In response to pressure, which fiber is most sensitive? A fiber, followed by B, followed by C fiber. In hypoxia, which fiber is most sensitive? B, followed by A, followed by C. Okay, you can make your own mnemonics very easy. And sometimes they ask you spike duration. Okay, spike duration means that is similar the part of the action potential basically. Spike duration more in case of slow conducting fiber. So here you have to remember, slow conducting fiber will have more spike duration. There will be more spike duration. Okay, so this is the bottom line. That's why you can find out C fiber, which is an unmyelinated fiber, they are highest spike duration. Okay, so this is one of the important slide in this classes, you try to remember. Bainbridge reflex, Cushing reflex we have discussed already, and Bejoel-Jerry's reflex I believe all of you know, that's why we are not going into detail. Bejoel-Jerry's reflex, what happens whenever there are certain chemical, like for example serotonin is present, okay, serotonin is present, or capsaicin is present, okay, hold on, बोल देते हैं, capsaicin is present, or veratridine is present, then what will happen? The patient will have severe decrease in blood pressure, severe decrease in heart rate. Along with that, there will be apnea. Along with that, there will be coronary vasodilation. Along with that, there may be bronchoconstriction also. So these are Bejoel-Jerry's reflex हो गया. पहले हम लोग डिस्कस किया Cushing reflex. I believe you remember that. Cushing reflex means heart rate will be lower but blood pressure will be higher. So this higher blood pressure will not be seen in case of Cushing reflex, and apnea is also not part of the Cushing reflex. Irregular respiration is Cushing reflex. Now for turbulent flow, you know, the Reynolds number is calculated for turbulent flow. So I'll take another slide here. So another thing you remember that there is one relationship, that is increase in length of the myocardium or increase in end diastolic volume in the myocardium leads to increase in contractility. You are talking about the reflex bata do. So this is known as the Frank-Starling law. Okay, then increase in heart rate can also increases the contractility. Let's hold on a little bit. Laptop में charge on. Yes. So increase in heart rate increases the contractility. What is this phenomena? An increase in afterload can also increases the contractility. So this is known as Bowditch effect. And the last one is known as Andreff effect. ठीक है. सो बेनब्रिज हो गया, कुशिंग हो गया, बेजोल-जेरिस हो गया, सब कुछ हमारा डिस्कस हो गया. And the last one, someone was asking that ये जो turbulent flow and laminar flow, so laminar flow होगा कि turbulent flow होगा? Turbulent flow होगा. It depends on which number? It depends on Reynolds number. Reynolds number. Okay. And Reynolds number, one of the important parameter is velocity of the flow. But for the time being, for your MCQ, just remember, if the Reynolds number is greater than 3000, then what kind of flow is going to happen, beta? Okay. And if the Reynolds number is less than 2000, okay, so less than, जितना less होगा laminar flow होगा, and जितना ज़्यादा होगा turbulent flow हो जाएगा, turbulent flow होगा, ठीक है. And if the Reynolds number in between, so it can be anything, it can be anything. Not confirmed. Okay, it can be anything, it can be turbulence also, it can be laminar also. अब बताओ हो गया सब कुछ? Okay, so this is, I believe that if you have to give a quick revision of all the important topics of physiology, so in single liner I have discussed most of the POIQ for the last 3 to 5 years. Also in images, important images I have discussed. The mathematical equation, 2-3 important mathematical equation which are important for your MCQ, that we have also discussed, and 2 important tables which you should remember, okay, at as maximum information as possible. Okay, so with this we are finishing the session. Yes, turbulent flow होगा तो प्रेशर डिक्रीज होगा बेटा इन दैट. ओके, ठीक है. हाइपोटोनिक आवाज़ नहीं करते, डायरोयानिटी डायग्राम और नहीं करते, उस टाइम कंज्यूमिंग है. सो दिस इज ऑल फॉर टुडे सेशन. इसको ही करो. ओके, माय एडवाइस, फॉलो दिस. ओके, so this is all for today. Almost 2 hours, as I told that this session will continue for 2 hours, and my best wishes to all of you. I believe by looking at the chat I can understand that you have read a lot, and you are going to do good in exam. So just I told that, just keep in mind that please keep your brain a little cooler. Okay, try to do a little relaxation practice. Breathing exercise is a very good relaxation practice because it has been proven that breathing, particularly the slow space breathing, activate our parasympathetic system. So it will give you immense help before your exam. Okay, so with this, okay, I'm ending this session. Thank you so much for listening. Best of luck for your exam. Thank you so much. Take care. Bye bye.